and welcome to Meet the Experts, Adolescent and Young Adult Edition. My name is Cassandra, and I'm a patient and family specialist here in the Patient Library and Welcome Center. We present these AYA sessions on a Tuesday or Wednesday once a month at 10 a.m., and today's topic is early menopause and premenopause, what adolescent and young adults should know. Before we start, we have a quick disclaimer. The content in this presentation is not medical in nature, and the viewers should consult their physician should they have any questions. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information contained in this presentation. And now it's my pleasure to introduce our speaker today, Lindsay Manley, who has been a nurse practitioner for 15 years and has been working in Moffitt's GYN clinic for 6 years. So with that, welcome, Lindsay.
Let's go ahead and get started. This session is going to introduce early menopause and perimenopause in young cancer survivors, and I want to focus really on awareness and support for you all during this. We're going to explore what menopause is, the occurrence after cancer treatment, and its symptoms in adolescents and young adults. So you'll hear me kind of interchange AYA and adolescent and young adults with you guys today. We'll learn a little bit about different strategies on how to handle menopause symptoms and then different emotional challenges that are also related to early menopause in young cancer survivors. And then I also am going to go a little bit into discussions on fertility concerns, sexual health, and different available supportive resources for the young adult cancer survivors. So, age and definition of AYAs. AYAs are individuals that are aged 15 to 39. This is a group that has distinct developmental and social needs. There are unique cancer challenges that AYAs will face, such as physical, emotional, and social challenges both during and after their cancer treatments. The life transition impact. There are major life transitions like education, careers, relationships, starting families. All of these things will influence the cancer experience for the AYA population. And then also menopause and care. So I want you guys to really get a good grasp on understanding the menopause effect on AYAs and how vital it is that we provide good support to you all as you go through this journey also. Understanding menopause and perimenopause. What is menopause? So the technical definition of menopause, it is the permanent end of menstrual periods, which is also caused by a reduction in estrogen and progesterone. So these different hormones will change as we go through menopause, and menopause is technically 12 months of not having a menstrual cycle. And we will talk a little bit about how that may become difficult and confusing for different AYAs as they are going through their treatment because you guys might not have menstrual cycles while you're going through your treatment. The natural age of menopause is typically between the ages of 45 and 55. The average age is about 51 and 3/4. So majority of women by the time they're 52 will have gone through menopause. And then there is early and treatment-induced menopause as well, which can be caused by things like chemotherapy, radiation treatments, and these can cause either early or temporary menopause in the younger patient population. What is perimenopause? Perimenopause is what you guys all think about when you start having hot flashes, night sweats, mood swings, all of those different kinds of things. So perimenopause, the actual definition is this is the transition phase before menopause when the hormone levels start to fluctuate a little bit. Some people, this will last for just a few months. Some people, this may last for 5 years, 10 years. You know, it varies based person to person. Common symptoms of this include irregular menstrual cycles, heavy menstrual cycles, longer ones, shorter ones, skipping them for a few months, mood swings, hot flashes. These are all the kinds of things that you will hear people talk about. Some women have thinning of their hair. They'll talk about being tired all the time. That's usually kind of one of the top symptoms we'll see people have is they come in and they see us and you guys will tell us that you're tired and you're not sleeping well at night. A lot of that comes from having interrupted sleep because you're having hot flashes throughout the night that are maybe waking you up and you're not realizing that they're waking you up at night. We do see premature onset in our AYA population, so they may trigger premature perimenopause in the adolescent and young adults. And this goes back to radiation therapy, chemotherapies, the use of different oral medications, surgical treatments. All of these can affect this for the AYA population. And I really want to stress the importance of awareness because we as the providers really want to understand the perimenopause symptoms that you guys are having because that will help us really recognize these symptoms and get some treatment in line so that we can make you guys feel better when it comes to experiencing all of this. Let's go into a little bit more detail about some of the causes of early menopause in the AYA cancer survivor population. Chemotherapy impact, that's kind of the biggest one that we all think about. Chemotherapy can cause damage to the ovaries, it can lead to reduced hormone production, and can cause early menopause in patients. There are some women who will have their menstrual cycles stop while they're on their chemotherapy, and then they may start back up again after a certain amount of time from completing treatment. Radiation therapy, radiation specifically to the pelvic area, can harm ovarian function, which can also contribute to early onset menopause. Surgical menopause, anytime we remove the ovaries from the body, this will cause an immediate menopause due to the loss of hormone production. I know there's a lot of women who, you guys go in for surgery, you get your ovaries out, you come out from surgery, and it is like someone flipped a light switch. There's mood swings that come along with this. There's hot flashes that come along with this. And I try to let you guys know that these are all very real symptoms. The surgical menopause happens very quickly. For the average woman, menopause, as we talked about earlier, happens over months or years. When you have a surgical menopause, you go in for surgery and you come out from surgery menopausal. So you may notice a little bit higher level of these different symptoms that you're having associated with menopause. And then there are also hormone blocking medications. So there are certain hormone blocking cancer drugs that can trigger menopausal symptoms by altering hormone levels. A lot of you guys who maybe have some hormone positive cancers, you go on these medications and you realize after starting these that you're starting to experience a higher level of menopause symptoms as well. So what are some of these symptoms that you guys can experience? Physical symptoms include hot flashes, night sweats, vaginal dryness. All of these are very common, probably the most common ones experienced. There are also emotional and cognitive effects. So mood changes, cognitive issues such as brain fog are very frequent symptoms during menopause. It's the whole you walk into the room and you forget why you came into the room kind of side effect. Impact of cancer treatment. Menopause caused by cancer treatments can intensify these symptoms due to sudden hormone level drops. So this is very similar to what I just talked about with surgical intervention and taking those ovaries out. It happens immediately and it's a very intense change that people will go through. Really, once again, I want to stress the importance of symptom recognition. So if you guys are starting to have any of these early symptoms, I want you to reach out to us and the providers and let us know so that we can make sure that we can get a good handle on how to control them better. Let's talk about some of the other physical impacts. So as we start to lose estrogen in our bodies, estrogen is very good for us before menopause. It protects our bones, it protects our heart, it protects our brains and our cognitive function. So once we start to lose that estrogen, you start to see some other physical impacts that can happen to the body as well. The big one is bone health. So early menopause increases the risk of osteopenia and osteoporosis due to that loss of estrogen. So you guys want to make sure you're talking with your providers about if it's appropriate to be on calcium supplementation. You want to make sure that you're getting your DEXA scans done so we can see what your bone density is so we can intervene if we need to. Different cardiovascular changes, changes to the heart. Loss of estrogen leads to cardiovascular changes, which increases the risk of heart disease. So you want to make sure you're getting your cholesterol checked. You want to make sure you're getting your regular blood work done. And then different preventative measures, calcium and vitamin D supplementation help improve bone strength. Exercise is also a way to prevent physical health risks. Weight-bearing exercises is something else that you can do to increase bone strength and bone density as long as it's safe with your specific diagnosis and where you are during your treatment journey also. Let's also talk about some of the emotional impacts. These are the things that people have a little bit more difficulty talking to us about because, you're just nervous to come out and let us know what's going on with things. So early menopause can definitely cause feelings of sadness, anxiety. You may feel overwhelmed by all of the different symptoms that you're experiencing in addition to going through this cancer journey as well. So there are going to be times where being overwhelmed is kind of becoming a very baseline feeling for you. It's very common, happens all the time. Self-image and relationship issues. Depending on the type of cancer that people have and the type of treatment you go through, there may be changes to your self-image. Concerns about fertility can impact personal relationships and your emotional health. And then I want to make sure you guys know about seeking support for this, whether it's through counseling, peer support groups, mental health services. These all play such a critical role in emotional well-being and helping our AYA population to transition through some of these symptoms and side effects that we go through. All right, this is the nitty gritty. I know this is what everyone wants to hear about. How do we fix it? So you guys come in, you have all these symptoms. What do we do to fix all of it? There are different medical options. So for women who are able to use hormone replacement therapy, it can easily relieve menopause symptoms, but it may not be safe for cancer survivors with hormone sensitive cancers. So anyone with a breast cancer that's an estrogen or progesterone positive breast cancer, you might not be a good candidate for this hormone replacement therapy. The good news is there are non-hormonal medications that can be used as well. There's a couple different antidepressants and other non-hormonal drugs that we can use to help manage hot flashes and mood changes during menopause. You may have heard your providers talk to you about either Effexor, that would be one of the antidepressants that we can use, or there's a new medication called Veoza. These will help trigger these hot flashes specifically to calm them down and help improve some mood imbalance as well through the process. Vaginal estrogen treatment. Once again, this is very similar to the previous hormone replacement therapy, as long as there are no contraindications from your specific cancer diagnosis. Then you may be able to use some localized vaginal estrogen to treat any kind of vaginal dryness, vaginal pain during intercourse. The vaginal mucosa becomes very thin and can tear very easily in the postmenopausal status. So this vaginal estrogen can help a lot with that. There's also vaginal moisturizers that can be used. These are non-hormonal and are safe for almost everyone. Most of them have hyaluronic acid in them. So what they do is they help pull water into the vaginal tissue to kind of plump it up and make it healthier like it was prior to losing all of that estrogen. You want to make sure that you're consulting your healthcare provider. So you want to talk with us very specifically about any type of, whether it's an over-the-counter medication, a prescription medication, a vaginal moisturizer, a vaginal estrogen. We want to make sure that you guys discuss all of that with us so we can make sure to tell you whether this is a safe thing and the proper thing that you should be doing to manage these symptoms. Different lifestyle tips. There's exercise benefits. Regular exercise helps alleviate menopause symptoms and will also promote overall well-being and long-term health. This will also have a big impact on your emotional health as well and just kind of make you feel better in every different way. Eating a balanced diet. Diet rich in calcium will help support your bone health and also reduce menopause related complications. Stress management. Meditation, stress management techniques, exercise reduces symptoms and improves the mental wellness during this perimenopause, menopause transition that you may go through. And then you want to avoid triggers. So different triggers that may increase, mostly hot flashes is what we think about with this, would be caffeine and alcohol. Those are the two big ones. Some women, when they have either one of these, they get a lot of flushing associated with it. So if you are one of those women that experiences that and you go through this perimenopause, menopause transition, you will notice continuing caffeine and alcohol will increase those hot flashes that you're having. It will also, just support overall health as well when we use all of these in moderation. Here's another big thing that I want to make sure we go over with you guys. Here's some more fertility and sexual health things. Fertility concerns. This is a really big one for the AYA population, and I want to make sure that we stress with you guys that you are addressing this at your first visit with us or very early on. We have lots of very good options for you guys. The impact of cancer treatment may impair fertility, causing significant emotional and physical concerns for young adults who are planning families. There are lots of different options. So fertility preservation options, you have egg and embryo freezing. These are the most common ones that people will use. And I really want to stress that you guys have these conversations early on. I know it's overwhelming. You have a new cancer diagnosis. You're not sure what the outcome is going to be. You're not sure what the long-term outlook is going to be with you. But if having kiddos or having a baby is something that's very important to you, I want to make sure that you bring it up with us because we are here to support you guys and help provide the resources that we need to enable you to have these babies if this is what you want to have. There's also post-treatment fertility assessment. So even after your cancer treatment, if this is still something that you might not have been able to pursue prior to treatment, but you really want to try to see if it's an option for you post-treatment, please let us know. There's different assessments and specialist consultations that we can help guide the best kind of family planning for you. And then obviously this emotional support again, providing emotional support for you guys is essential when you're coping with different fertility struggles that may arise from your cancer treatments. Sexual health, menopause effects. It can cause vaginal dryness, discomfort, libido changes. All of these will affect sexual health and comfort and overall relationships. Use of lubricants. So I talk about the moisturizers here. That's what I had mentioned earlier. Lubricants with intercourse, you can't really use too much of it. Water-based lubricants are what I typically recommend for my patients. Both of these together can help improve the sexual experience that happens during the perimenopause and menopausal transition. Open communication, making sure you discuss these things with your partners, what's working, what's not working, how you guys can work together to really make a new life and a new balance for how your sexual health is going to be in your relationship. And then just the importance of it. Sexual health is essential to overall well-being. And we want to make sure that we're addressing this and treating this in you guys without any kind of stigma or shame associated with it. All right, how about some other support and advocacy areas? There's different peer groups. Peer groups provide a platform for AYAs to share experiences and gain different emotional support from those that have been through similar experiences and challenges. Professional counseling services can also offer guidance and strategies to help AYAs manage emotional and psychological challenges. And then different online communities provide accessible platforms for AYAs to connect, share resources, find continuous support. You know, the AYA population is a very technology centralized population. So I know you guys really use these online communities and these technology platforms in a fantastic way. And I think the big thing is just knowing that you all are not alone and there's lots of other people that have gone through similar experiences that you both can learn and grow from each other's experiences and each other's challenges. So I think these are all just excellent resources for additional support outside of what your medical providers can give you. Talking to your healthcare team. I always want to empower communication. I want you guys to ask about symptoms. I want you to ask about treatment options. I want you to ask about how to better manage your menopause symptoms and your overall health. Symptom tracking, keeping a track of symptoms really helps us figure out what the best options are going to be to giving you more of a normalized lifestyle again. And then I want you to advocate for yourself. You know, this leads to better health outcomes, more personalized care. If I always say, I don't go home with you. So if you don't tell me during your visit, I don't know what's going on. You know, so I want everyone to be very open and honest with me about things. I love it when you ask questions because when you ask questions, you understand why we do the things that we do. And then that just empowers you guys to really feel stronger and be able to, you know, learn about your bodies and how to treat your bodies to make yourself feel the way you felt before all of this started also. And with that, we are getting to the end of it. So just some summary key takeaways for you guys. The commonality of early menopause is frequently occurs in adolescents and young adults following cancer treatment, and it does impact the overall health and well-being. Management strategies. There are symptoms of early menopause that can be effectively managed through different medical treatments, lifestyle adjustments, emotional support, all kinds of options. And then fertility and sexual health. We want to make sure that you guys are having open discussions about fertility and sexual health. These are vital, and we do have available resources to support anyone who is interested in pursuing this further.
Thank you for viewing this session. We offer live adolescent and young adult Meet the Experts sessions through Zoom. And to view a list of upcoming sessions, please visit moffitt.org/meet the experts or call 813-745-1690. Thank you.